So in this video, let's talk about asthma. So what is asthma? Asthma is also known as bronchial asthma, and it is a condition that affects your lungs. It is a chronic or ongoing condition, meaning it doesn't go away and needs ongoing medical treatment. So asthma affects lots of people in the world, and let's talk about what is an asthmatic attack. When you breathe normally, muscles around your airway are relaxed, letting air move easily and quietly. During an asthmatic attack, three things happen. There is bronchospasm, there is inflammation, and there is mucus production. So under the bronchospasm, the muscles around the airway constrict. When they tighten or when they get constricted, it makes your airway narrow. Airway cannot flow freely without constricted airway. So we have said there are three things that happen when there is an asthmatic attack: bronchospasm, inflammation, and mucus production. Bronchospasm, it means that the airway, the muscles around the airway constrict. They may, I can think you can feel what I'm trying to say. They have tightened. So when they tighten, it makes airway narrow. The airway becomes small. Airways now, the air, not the airway. Air cannot flow freely through the constricted airway. You understand? Now we have inflammation. So because we have said there are three, so let's talk about inflammation. So inflammation, the lining of the airway becomes swollen. So when the airway gets swollen, the airways don't let as much as air in or out of the lungs. It gets swollen. Kama imeswell, see, it reduces the airway. It means now the air will not get out or will not get inside the lungs. We have the mucus production. During the attack, your body create more mucus. So the mucus, this thick mucus clog the airway, zip at the airway. So we have said that during the attack, there are those three things that happen: the mucus production, the inflammation, and the bronchospasm. When your airway gets triggered, you make a sound called wheezing. When you breathe, a noisy, and when you breathe, a noise your airway make when you breathe out. Then when you might also hear an asthmatic attack called an exhibition or flatten up. It's the term for your asthma is not controlled. It is the time when your asthma is not controlled. So what are the types of the asthma? What are the types of asthma? Asthma is broken down into types based on the causes and the severity of the symptoms. So healthcare providers or the researchers identify asthma as intermittent and persistent. So under intermittent, persistent, we also have the allergic, non-allergic, and also we have the adult onset and pediatric onset. We also have exercise-induced asthma. We have occupational induced. We have several. We have said they are based on the severity and the symptoms. the severities of the symptoms and the cause. Yeah. So let's talk about the intermittent. Intermittent, this is a type of asthma comes and goes, so you can feel normal in between asthma flares. Persistent asthma means it may persist. It has persisted. Persisted asthma means you have symptoms much of the time. Yeah, you are wheezing several times for longer hours, and symptoms can be mild, moderate, or severe. Yeah, we have asthma as multiple according to causes, where we have the allergic and non-allergic. Allergic asthma, some people's allergies can cause an asthmatic attack. So allergen, including the mold, the pollen, the pet, the whatever, can cause asthma. We have non-allergic outside factors. Outside factors can cause asthma to flare up. So exercise, stress, illness can cause asthma. Those are the non-allergic factors. Also, asthma can be caused by an adult onset, where someone starts getting asthma above 18 years. This person get an attack after 18 years. And then we have pediatric asthma, where this child get an asthmatic attack below 5 years and below. Yeah. In addition, there are this type of asthma, exercise-induced asthma. As the name suggests, you just know occupational induced asthma. As the name suggests, maybe you are working in a quarry and you get attack because of the exposure to those dust, maybe. Yeah. Then also we have the asthma COPD overlap syndrome. This type happen when you have both asthma and chronic obstructive pulmonary disease. Both diseases make it difficult to breathe. So, yeah. Who can get asthma? Anyone can develop asthma at any age, because we have said we have the onset which start after 18 years, and then we have the one that starts below 5 years. So anyone can get any ulcer at any age. People with allergic or people who are not even exposed also can get asthma. Yeah. Also, another thing that you have to know about this asthma: exposure to smoke, exposure to maybe occupational things like maybe a lot of dust. Yeah, can cause can expose you to get asthma. What are the causes? Allergies, environmental factors, genetics. You find some people asthmatic attack come from the lineage. And also we have the respiratory infections, such as respiratory such as respiratory syncytial. Syncytial. I don't know how to pronounce it, but just know respiratory infection can also cause asthma. What trigger asthma? Air pollution, dust, exercise, mold, pets, tobacco smoke, strong chemical smell or scent. A certain occupational exposure can trigger. What are the signs? Now, these are the things which is important that you are supposed to know. People with asthma usually have obvious symptoms. These signs and symptoms resemble many respiratory infection, like chest tightness, pain or pressure on the chest. We have cough, especially at night, and then also we have shortness of breath. We have wheezing, which is common, and that is one of the things that usually are being used to diagnose asthma. With asthma, you may not have all of these symptoms with every flare. You can have different symptoms and signs at different times with chronic asthma. Also, symptoms can change between asthmatic attacks, so it doesn't mean that if this time you are coughing, the next time you will also cough. So it can change with the various attack. Management, that one the healthcare providers knows very well. They manage it with bronchodilators, anti-inflammatory medicines, We have the biologic therapy for asthma. These are used for severe asthma when symptoms persist despite proper inhaler therapy. What is asthma control? The goal of asthma treatment is to control symptoms, because you will live with it the whole of your life, and even your death can come from it. So asthma control means you can do things you want to do at work and at home without any problem. Also, it means you have or you don't have any symptoms. You have minimal or you don't have any symptoms. Yeah. Prevention, it depends with the prevention about the asthma. We have seen that some are caused by genetic or history. Some are from exposure, environmental factors, smoke. So prevention also will depend with the cause. So if maybe, for example, you are coming from a family where people suffer from asthma, then it will be very hard for you to get prevented from getting it. But if the asthma is caused by environmental factor, those are things that we can avoid. You can avoid smoking, you can quit the things you do, yeah, those things like that, or things like those, yeah. So I think we're gonna stop from there. Let's meet in the next video. Tell me what you want me to talk about in the next video. In the next video, let me promise you I will talk about pneumonia, because pneumonia is so common in children. Yeah. Bye till next time.